Some of the symptoms that one might have when you're having a heart condition, it kind of depends on what is the main cardiac problem that one is having. There are the two main categories. One is referred to coronary problems, which is mostly based on the irrigation or the blood supply to the heart. And the other one is with the malfunction of some of the valves that the heart has. When people are having problems with the blood supply or the coronary symptoms are also related to how they happen. And what that means is if someone can have symptoms when they are exerting themselves, or they can be having symptoms when they are resting or not doing a lot of activities. Most of them on the males are very well described, and those are the typical chest pain or pressure or that radiates to the back or to the arm, sometimes even to the jaw, and that are classical for what people describe as angina. Sometimes women can have different symptoms than men and are not as classical, and this was probably emphasized over the last 15 years or so, where women are more tired or sometimes can have new onset of what's called heartburn, where they feel this discomfort on their chest, which is new onset. And again, emphasizing in women sometimes can be tired and losing the energy and not being the same over the last few months are probably some of the signs of coronary artery disease. Now, when people have valvular heart problems, which is a different topic, they could have similar symptoms related to angina, but most of the times are short of breath. Somewhat they lose their breath when doing some different activities like going up the steps of their house, or maybe even just with different activities that they used to be doing. They're not doing them now because they feel they can't catch up their breath. And that's important to notice at which level there is, and that's when, if you have some of those symptoms, you can consult your cardiologist to maybe further elucidate what the problem is. Another thing that it happens is people, and this may be a little more drastic, is they can have a change in their heart rhythm. Now, there are changes in the heart rhythm that happen with age and can happen or in relation to valvular heart problems. Some of them are when people pass out. All of a sudden they get up and they have what's called a syncopal episode, which could be related to a heart rhythm, or it could be related to a period of the blood pressure dropping in relation to a valve that is too tight and it can't compensate for the increase in demand of the blood flow that is triggered by the changing in position. So those are the symptoms in a broad spectrum that we can say are an alert for heart problems, and one may have to work on it.